Assalamu alaikum, welcome back. You are listening to the Mara Mukwanda show on Salam Media, and it is the first show of the month of September. Today is the 1st of September 2020. All right, it is also Health Tuesdays, Women's Health Tuesdays, and today we're going to be talking about the new mother and taking care of yourself post birth, as well as a postpartum psychosis of what it is and how do you determine it and how is it treated with Dr. Tom Mukaya, our OBGYN, who is on the other side. Good afternoon, Dr. Tom.
Good afternoon. Good afternoon to you and good afternoon to your listeners.
Thank you for joining us once again. All right, Dr. Tom, the postpartum period involves your moving through many changes, both emotionally and physically. It often lasts 6 to 8 weeks. So, what happens to a woman's body during this time?
Good. Well, thanks for having me. Now, the body prepares itself over 9 months for the finale when the baby is born. After the baby is born, the body has to start undergoing what we call as a reset stage, where things go back to where they were before one falls pregnant. And the physiology and the way in which the body goes back to where it was is just an amazing art of nature. Now, what one needs to know is that when one is preparing for delivery, and of course the process of carrying a baby, there are many changes that occur in the body. There is things like water retention, is things like the amount of blood that one has increases in the body, etc., etc. And even after giving birth, the body therefore has to go back to the normal stage where it was before. And as you correctly said, that takes up to 6 weeks, and that is the postpartum period, which we also call the puerperum, where the body goes back to where it was before. And there are many things that happen. The uterus gets smaller. The uterus, one thing that people don't realize is that the uterus is actually almost as small as an egg, a chicken egg. That is how small the uterus can be. But it expands to a size where it can carry a baby that is almost 4 kilograms. I mean, there are moms who carry babies that are 5 kilograms. You can imagine that amazing organ expands that much. And then in that stage, it has to go back to its normal size.
Mm-hmm.
And that is one aspect of what has to change. The muscles around the vagina now also have to go back to almost normal to where they were if one has had a normal birth. And of course, there are many things, there are many changes that do occur for the body to go back to almost where it was before one falls pregnant.
Mm-hmm. Now, why does it pain so much when the muscles are constricting and going back to what they were before pregnancy? I mean, like I experienced that and I had no idea what was going on. I'm like there, and I was like, I thought this was all over. Why is this happening?
That's a very good question, an experience that we see all the time. And that change starts immediately the baby's born. But let's concentrate around the gynae organs for now. When one has given birth, the uterus and the baby is out, and then immediately the baby comes out, the uterus has to start contracting to expel the placenta. And that feels like you're in labor again. And you ask yourself, the baby's out, I can hear the baby's crying. Why am I having these contractions again? Now, those are the first contractions you have because the uterus is contracting to expel the placenta. Now, once the placenta is expelled from the uterus, just to remind you that the uterus receives almost 10 to 20% of the blood supply when one is pregnant. And immediately you give birth, that blood has to be supplied to other organs. And the way that happens is that the uterus is a sponge, so it contracts extremely quickly and extremely fast. And during the process of that contraction, it can be very, very painful, almost like you're in labor once again. Because if that doesn't occur, one can bleed a lot. One can bleed a lot if that doesn't occur. Yeah.
Wow.
So
Okay.
that is what happens. And therefore,
All right.
that is one of the processes. That is one of the things that do occur when one has given birth.
Okay, Dr. Tom, we know about postpartum depression, but what is a postpartum psychosis?
Now, the psychological changes that do occur in pregnancy is a whole spectrum, which starts from postpartum blues to severe postpartum psychosis. So it's a whole spectrum of psychological changes that do occur. And the mildest are postpartum blues, where when the baby comes out, one feels a little bit unhappy, and once in a while they may even become emotional and become tearful, to a scale where one is so severe that one becomes suicidal, and it even reaches a stage where some moms feel like they want to throw away the baby. They don't want to throw a baby. So it's a whole spectrum of changes that do occur. We do understand a little bit of why that occurs. One is because of the hormonal changes that happen in the body. There are some hormones like estrogen and progesterone. When one has given birth, the progesterone level tends to increase, which obviously is going to lead to the production of milk, and new hormones like estrogen start coming into the body. So essentially, because of the hormonal changes that occur in the body, one may tend to have psychological changes. And some of them can be so severe that we have to medicate some of those patients because they become suicidal. They become unhappy. They don't want to breastfeed. They don't want to take care of their children, etc., etc. And obviously, apart from medication, one obviously would require a lot of psychological support and family support to be able to help them through this phase of postpartum psychosis or postpartum depression or postpartum blues.
All right. So, why is self-care so important for new mothers? And just give us a few tips on what new mothers can do during this postpartum period.
During postpartum period, we tend to experience a lot of changes that do occur, and there are some complications that may occur. Some of those complications of the postpartum period include infections, which may be common in some women. One, two, some women may develop complications like having blood clots in their body, and of course, as you mentioned before, some women may experience some psychiatric problems. So it's very important that simple hygiene is maintained, because after giving birth, whether it's natural birth or through a Caesar, there's a lot of blood, and therefore physical self-care is very important. Otherwise, one may develop infections, and some of those infections could be infections of the wound, either if it was a Caesar, or infections around the perineum, if there are any tears and lacerations around the vagina. That has to be cleaned either with an antiseptic, but we normally advise one uses simple salt water to keep it clean. Otherwise, it will get infected. And some patients think that once they've given birth, they need to go and sit in a particular room and do nothing. That may predispose them to getting blood clots, either in the lungs or in the legs. So moving around and being active, it is important. And even at times to even socialize, because that will also help to reduce the chances of postpartum psychosis. Because taking care of a child is whether one has had a child before or is the first child, you need a lot of psychological support. So as part of the self-care is to open up and discuss what you feel. And when you discover that, oh no, what I'm feeling, some people have had it before, and some people may give you tips because you feel like you cannot be able to take care of the baby, you can't take care of yourself. So all those things come into the spectrum or into the box of self-care postpartum.
And I'm glad that you mentioned about not just sitting idle in one place, because I know sometimes they'll tell you to rest and sleep when the baby sleeps, and it's not that easy. Sometimes we you try and sleep when the baby sleeps, but there's only so much that you can do, and sometimes your body will not allow you to sleep also because you need to do other things, or your body wants to recover. And everyone is different. Everyone's journeys are different as well. So what works for someone might not work for others. Now, coming back to psychosis, um, how is it treated?
Now, the treatment of psychosis actually starts when one is pregnant, because when one is going through the antenatal clinic, one can be able to pick patients who are predisposed to being psychotic or having postpartum depression, because they're probably very unhappy during pregnancy, and one takes a social history to find out how much family support one has. In instances where probably one doesn't have very good family support, the risk of postpartum psychosis increases, and therefore that discussion of postpartum psychosis is introduced then. And in cases where one has had psychosis before in a previous pregnancy, then we know that, here we need to keep an eye on. And in some instances, we even introduce mild antipsychotic drugs. Now, when one has delivered, uh, once the baby is delivered, one of the most important ways of treatment is psychological support, because one feels like, oh no, I can't be able to take care of the baby. I don't know how to take care of the baby. I can't be able to breastfeed. And then at times, lovingly, one may get a lot of advice, and then you feel overwhelmed. So psychological support is the cornerstone of of treatment of postpartum psychosis. When it gets really, really bad, then one needs to see a medical profession, and then we introduce mild antipsychotic drugs. And there is one that we normally give. In fact, what it does two things. It increases the breast milk, which is a good thing, because once the baby sleeps, okay, the mother is also happy, and the other family members are also happy. And then it also controls the mood, and we find that it works very well in patients who have um, postpartum psychosis. So there is a conservative psychological treatment, and if that fails, then we prescribe mild medications which can be used for up to 6 weeks or as long as it's required.
Wow, hey, you know what? This issue of postpartum is very broad. It doesn't just start with postpartum. There's depression and psychosis, and there's just so many things that women go through. But wow, it is a learning curve. And thank you, Dr. Tom, for always making the time to chat to us about these female health issues. And today, also, thank you for your time.
Thank you. Thank you very much for having me.
Have a wonderful day, Doctor. That was Dr. Tom Mokaya, OBGYN, talking about taking care of yourself postpartum, post-birth. This is especially for the new mother. It is a difficult process if it's your first child, and you don't have the support, it can be a very, very daunting task. But then all pregnancies are different. So your first experience won't be the same as your second experience. And I just wish that everybody has a good experience. Mine was it was here and there. I can't really say it was good. I can't really say it was bad. I know the best part about the pregnancy journey was that I didn't have no morning sickness or cravings. So yeah, and I lost the pregnancy weight really, really easy. And that's just like that. But now that's not so easy after the lockdown, well, during the lockdown. Anyway, guys, if you have any questions for Dr. Tom, please leave them in the comment section. Or if you have any comments, follow the same procedure, leave them in the comment section or send them to us on WhatsApp. The number is 061 766 0355. We will be right back.